Caregiving can sometimes feel like an impossible struggle. Caregivers may be torn between taking care of loved ones and trying to maintain balance in life. The good news is that it doesn't have to be that way. The Caring Generation with host Pamela D Wilson is here to focus on the conversation of caring. You're not alone. In fact, you're in exactly the right place to share stories and learn tips and resources to help you and your loved ones. So now, please welcome the host of The Caring Generation, Pamela D Wilson.
This is Pamela D wilson, caregiving expert, speaker, consultant, and guardian of the Caring Generation. The Caring Generation focuses on the conversation of caring, giving us permission to talk about aging, the challenges of caregiving, and everything in between. It's no surprise that needing care or becoming a caregiver changes everything. The Caring Generation is here to guide you along the journey to let you know that you're not alone. You are in exactly the right place to share stories and learn about caregiving programs and resources to help you and your loved ones plan for what's ahead. Invite your aging parents, spouses, family, friends, colleagues, co-workers, everybody you know to listen to the show. If you have a question or an idea for a future program, share your idea with me by responding to my social media posts on Facebook, Instagram, Twitter, YouTube, and LinkedIn. You can also go to my website, PamelaDWilson.com, click on the Contact Me button, and then complete the caregiver survey. This week's conversation: what if a parent can't pay for nursing home care? We will look at this from a timeline perspective, beginning to end, and talk about the steps to get care for a parent who needs nursing home care in that second part of the program. So if you think about life, we're born and we die, but there's a lot of time in between that life happens. Healthcare concerns and caregiving also have timelines. It's like the time you realize that you are a caregiver, and then the day that you realize your caregiving days are over. Somewhere in the middle, you might ask yourself, what if a parent can't pay for nursing home care? We will take this timeline in stages, beginning with health prevention, then managing chronic diseases like heart disease, diabetes, arthritis, and others, to the point where an elderly parent or spouse needs ongoing help from a caregiver. Then we'll talk about unexpected emergencies that send a parent to the hospital and a nursing home, or a health decline that is so serious you are considering the reality that mom or dad may permanently need nursing home care, and you're not sure what to do. Nursing homes are what I like to call a home of last resort. Nobody wants to go to a nursing home or live there permanently, but sometimes health problems are so severe or time-consuming or medically complex that living at home with caregivers or in an assisted living community with care isn't enough to provide the necessary round-the-clock care. So for caregivers listening, I want to start with health prevention for you, because if you're going to be able to care for your elderly parent and you want to stay out of a nursing home today or anytime in the future, being proactive with your health and your lifestyle habits is the way to make this happen. If you're beginning to help an elderly parent who doesn't yet need a lot of help, this information will also be beneficial for ways to delay or keep mom and dad living at home and out of a nursing home. You also may be able to defer or delay more extensive and expensive care. So if you're proactive, you may be prepared and able to answer the question, what if a parent can't pay for nursing home care? Maybe you already have a plan in place. But let's say that you don't. So for this episode, I encourage you to go and get a checkup if you haven't had one, or if it's been some time since your last annual physical. Do it, get it scheduled. Health routines were interrupted by COVID, and not everybody is back on track with their medical care. A yearly visit to the doctor is the best way to identify if new or current health issues need attention. Do you know your numbers? Blood sugar, cholesterol, triglycerides, and any other important numbers in your blood work. Do you exercise regularly? Are you at an appropriate weight for your age and height? If not, an opportunity exists to be proactive. The same possibility applies to the health of an aging parent or spouse or whoever you are caring for. While paying more attention to health, nutrition, exercise levels, weight may seem like a hassle or unimportant or even dull, when you're 90 and living in a nursing home, you might look back to today and feel differently. Unfortunately, gaining that type of perspective on life doesn't always happen until we are in an irreversible situation and we can make a before and after comparison, where, of course, the before looks so much better. But by then, it's not always possible to turn back the clock. We don't always get a redo. Has your parent ever been in a nursing home for rehab? If not, mom or dad probably has an outdated vision of care in a nursing home and what they look like. Nursing homes and rehab centers, they're the same thing, just different terminology. They're very different today than from 20, 40, or 60 years ago, which is probably the memory that your parent has, especially if their parent or grandparent or somebody else they knew was in a nursing home. Don't get me wrong, residing in a nursing home isn't like living in a hotel. It's more of a cross between a hospital and college dorm rooms. I say dorm rooms because nursing home rooms are usually shared. There's not a lot of space. You have a neighbor or a roommate. There are many reasons why living in a nursing home might be unattractive. You're not living in your home. There's very little privacy, limited space for personal belongings. When they wash your clothes, they get lost or end up in somebody else's closet, as well as expensive things like dentures, hearing aids, or eyeglasses disappearing. If you have a loved one in a nursing home, you know there are so many things to monitor in addition to their health and medical care, like making sure their personal belongings don't get lost. So let's keep moving ahead to family caregivers providing chronic disease care for aging loved ones. If you care for a parent and take them to doctor appointments or help with any other type of medical care, you are probably in the chronic disease stage. Let's say mom or dad has high blood pressure, asthma, arthritis, or another condition that prevents them from doing everything they used to do. Maybe they are physically weak or easily become tired. They don't do all the things they used to do, like play golf, garden, participate in social groups, or attend events. Maybe they've even stopped driving. The point here is life isn't what it used to be. Mom or dad's activities might be limited because of their health. They're doing their best, but they rely on you or others for help with a lot of things. Managing chronic diseases can involve taking prescription medications while still doing preventative activities like exercise, eating right, and so on. But there may be a sense in the family that mom or dad's health probably isn't going to get better at best. Everything you and they do will help them maintain their current health, which is a positive outcome, right? But it's also very likely that at some point, due to age, we're all getting older, that mom or dad's health will decline. This is why if you haven't talked about what if a parent can't pay for nursing home care, now is the time to initiate that conversation. It's a more extensive conversation if you haven't really talked about worsening health issues and all of the choices to make, or maybe you don't even know what your choices are. This is not a topic that any of us look forward to discussing because there's a lot of uncertainty, a lot of unknowns. As a caregiver, you may not know how to begin the conversation. My website, PamelaDWilson.com, has a lot of tips for beginning conversations about health, aging, caregiving within families, legal aspects, financial aspects, what to do when family members don't get along. So much information there. In times of uncertainty, when you don't know what to do about your health or a parent's health, or how to investigate support and services, where do you start? I encourage you to reach out. While searching for information can take time and effort, the alternative of not doing so can be more harmful in the long run. Delaying healthcare by not seeing a doctor because you're too busy or have other life complications happens to everybody. It's essential to prioritize health and well-being when parents have multiple health issues. When elderly parents do less because they don't feel well, or they might be worried about going out in public and getting sick, they become more socially isolated. Becoming socially isolated is an unintentional factor in having health problems. So in a sense, the world of elderly parents shrinks. It becomes smaller, like the four walls of a room. And as a result, mom or dad become more reliant on you, their caregiver. Isolation leads to loneliness, and it can increase levels of depression and anxiety. You may notice that your parents' emotions are up and down depending on the day, even the time of day. They may be negative or critical. The behaviors of the person you care for that become challenging are hugely misunderstood if you don't have detailed conversations. Mom or dad may not be good at expressing how feeling unwell affects their life and their mental attitudes. They may not understand that one thing relates to another, cause and effect. And for the caregiver, all you see is an elderly parent who is demanding, unappreciative of your efforts, mean, critical, or negative all the time. Think about this. When a person has one chronic disease, heart disease, arthritis, something else, it's like a body system not working. So, heart disease relates to the cardiovascular system. Dementia relates to the neurological system. Rheumatoid arthritis is an autoimmune disease that affects your immune system, but it also attacks healthy tissues in your joints. These health conditions can cause more medical problems with other body systems like your skeletal system, digestive system, endocrine, urinary tract. So when you don't pay attention or treat an illness because you're too busy or it's not important, it's essential to realize that this condition will likely negatively affect other body systems and cause more diseases. I don't say this to scare you, but to reinforce the importance of preventative care. If you want to feel well, you want your loved ones to feel well, everybody wants to live a happy and fulfilling life. Health insurance exists so that you can get the care you need. So don't be afraid to use this benefit to get the care that you need and to prevent a small issue from becoming a really big problem today or later. Maintaining a positive attitude and an outlook can take a lot of work or effort if somebody doesn't feel well. Even for people who feel well, it can be hard, especially if you have a lot of other life issues like trying to hold down a job, caring for children, transportation issues, if you don't live in a safe neighborhood and you're worried about going out. Family caregivers can struggle with the same emotional challenges that elderly loved ones experience, but for different reasons. Chronic disease, health problems result from stresses in other parts of our lives. So trying to keep it all together and live a good life is complicated when health problems exist and a person does not feel good all the time. It's kind of like operating on a low battery or you've got a quarter tank of gas. Eventually, you run out of physical and emotional energy. So where do you find support to manage chronic disease? The first place is your doctor's office. If you don't have a doctor, get one. Establish care. We all know that time for medical appointments is limited by insurance companies. So to make the time effective, you want to be well organized. If you're looking for more information about how to prepare for a doctor's appointment, how to talk to doctors, what information you should take, what questions you should ask, go to my website, PamelaDWilson.com. Check out my online caregiver program and this segment about managing medical care. I'll put a link in the show transcript on my website. What if a parent can't pay for nursing home care? What other steps can you take to be proactive today in this area? So let's go back to medical appointments. You're feeling rushed. You're not getting enough information, enough support, so you're frustrated and you think, I don't want to go back. This doctor doesn't care about me. Well, here's the secret. You may need to schedule one visit to discuss one condition and another appointment to discuss the next condition. It can take several meetings with a doctor to establish a trusting relationship. And beyond the relationship with your doctor, it can be beneficial to establish a relationship with a nurse, nurse practitioner, or medical assistant in the doctor's office, who you can talk to if the doctor's not available, or who you can even see if the doctor's not available. Beyond establishing this regular medical care and a trusting relationship with your healthcare provider is contacting disease-specific organizations to obtain access to more information. When you start searching, you will find organizations specializing in heart disease, multiple sclerosis, Parkinson's, Alzheimer's, arthritis, and cancer. All of these organizations have websites with information. Now, I know there's this gap that caregivers get frustrated with between finding generic information that may not be helpful, things that you already know, and needing or wanting more specific information that applies to your health or care situation. From my personal experience in helping family members and persons needing care, I kind of put these into categories. So navigational, social, problem-solving, collaboration, and teamwork skills that you might have or that you can learn. These skills also come in handy when you need to make decisions and you're fretting about, what if a parent can't pay for nursing home care? What are we going to do? Another essential skill is continual curiosity, a desire to learn and asking questions. Becoming a great question asker is a skill that everyone can learn and one that will help you. It'll be invaluable in the role of a caregiver and in all parts of your life. Another vital skill that relates to what if a parent can't pay for nursing home care is the idea of presence. Being present and attentive can be difficult for caregivers who juggle multiple projects at the same time. You have so much going on that you may not be alert to small details, things like misplacing your car keys, forgetting to take your lunch to work, going to the grocery store and leaving without that one item that was the reason you went to the grocery store in the first place. We've all done these things. Forgetting things and missing essential details are some of the perils of distraction or inattentiveness. Being present allows you to notice small changes in a parent's health or activity level that might indicate something is changing. For example, when I managed the care of clients, I would walk into a person's home. Immediately, I could sense or see that my client wasn't feeling well, was emotionally upset, or recognize that something else was going on that I needed to investigate. Noticing the little things is essential when managing chronic disease and healthcare for loved ones. For example, something as simple as a change in medication, whether you're adding or deleting, can result in side effects. Likewise, a change in mental confusion can mean that a parent has a urinary tract infection and should see a doctor. It's kind of like being familiar with the car that you own. When you hear a new noise or a strange sound, you know it's time to get it checked out before your car breaks down. Let's take a break and return to more of what if a parent can't pay for nursing home care. I will take you through the steps of finding options for a parent to get care, even if you don't think they have the money to pay. Caregiving doesn't have to be a do-it-yourself job. My website, PamelaDWilson.com, offers help, support, and education for caregivers and aging adults by way of online courses, articles, and more. Plus, this podcast, The Caring Generation, answers questions that you ask. It's available worldwide on my website and your favorite podcast and music apps like Apple, Spotify, Spreaker, and more. This is Pamela D Wilson, caregiving expert and advocate on the caring generation. Stay with me. I'll be right back. This is Pamela D Wilson, caregiving expert on the caring generation. Check out my website, PamelaDWilson.com, where you will find my online caregiver course, book, The Caregiving Trap, caregiver blog, this podcast, articles, so much information in my caregiver library. There's something for everyone at PamelaDWilson.com. What if a parent can't pay for nursing home care? Worrying about an aging parent needing care can be scary if there are serious health problems or a caregiver can't physically or emotionally provide care. Let's review a scenario of a parent admitted to the hospital for a severe illness or an accident. Mom or dad is in the hospital for a few days. As a result, they are physically weak. This is probably to be expected. Older adults usually don't come out of the hospital better than when they went in. So if you're following my recommendation to be curious, you might wonder what I'm talking about. A hospital is a place where you go to get better, right? How many of you have been in the hospital? Do you get any rest? Or are you sleep deprived because nurses come in every 4 hours around the clock to check and record your vital signs? The correct answer is the latter. While you have access to medical care, being in the hospital can be exhausting. And if you had multiple health conditions before you arrived and you weren't physically active, what do you think happens then? A person quickly becomes physically weaker because, unless you insist on making an effort to get up and walk around in the hospital, which is difficult because you are connected to an IV machine, you or an elderly parent is going to lay in bed for days. So for a 70, 80, or 90-year-old person with a lot of health problems, the hospital is a great place to receive medical care, but a horrible place for anyone who is not in tip-top physical condition. This sounds contradictory, right? The body becomes deconditioned, weak, due to physical inactivity. And it's likely that if the person you care for has cancer, heart disease, physical injuries, or other health issues, their body was probably weak before the hospital stay. So returning to solutions for what if a parent can't pay for nursing home care, physical activity is one of the best things you can encourage. In this case, that no pain, no gain theory applies. After gaining clearance from a doctor for physical activity, go for it. Participate in a physical therapy exercise regimen, find a physical trainer, go to a gym, walk outdoors, buy small weights or rubber bands to build strength, watch YouTube exercise videos, and follow along. Let's talk about nursing homes for a minute. Elderly who permanently reside in nursing homes also have multiple health problems. Most are physically weak. Is your parent a fall risk, or have they already fallen? Falls are a significant indicator of a future inability to remain safe and independent living in a home. So the correct question may not be, what if a parent can't pay for nursing home care, but what if a parent, or anyone, refuses or fails to participate in preventative health care and does not recommend or realize the benefits of exercise? It's something to think about, and I can see and hear you all thinking. You're learning the importance of the asking question skill. It's the questions you don't think to ask that cause the most trouble. Okay, let's take one step back. What if a parent who's in the hospital needs more care, is not physically fit to return home, and can't pay for nursing home care? I will tell you there's good news. In many cases, but not all, there are no 100% guarantees for anything. Your parents' health insurance will pay for a rehabilitation stay in a nursing home, also called a rehab center, for your parent to get exercise. So as the caregiver, here is what you do. These are the steps, and recognize this is a time-sensitive activity, so don't procrastinate, don't delay. Your parents in the hospital. You're worried they're not going to be able to return home. They don't have a lot of money to pay for care. You can't be the caregiver. You can't do it all. Ask to speak to the case manager or the hospital discharge planner. Go to this person and make it clear that your parent has health issues and they're so physically weak that it's not safe for them to return home. Don't let the case manager talk you into having a parent move in with you or vice versa. You move in with a parent even temporarily, because temporarily means long-term. Remember, you have a job and a life. Your mom or dad's health insurance will pay for rehab. Also, make it clear to mom and dad that going to rehab is not an option because you can't provide the level of help they need. So we're all agreed here. You talk to the case manager at the hospital. She finds a nursing home for your parent. So after the hospital, the next step is a nursing home for physical rehab, which means your parent's going to receive help with daily exercises to regain physical strength and stability to avoid falls. Once your parent is in the nursing home, you're going to do the same thing. There's another immediate action for the caregiver. You are going to contact the case management department there, because Medicaid, not Medicare, is a state program. Now, it goes by different names depending on the state where you live, but it will pay for long-term care that we'll talk about in a moment. So you're at the nursing home. Schedule a care conference as soon as possible so you can meet the staff caring for your parent and share an understanding of your goal. A goal in rehab is something like, mom and dad are going to be able to walk 500 feet independently or with a walker. They're going to go back home and they're going to be pretty independent. Now, this goal is relative because if your parent wasn't very independent before, it may not be possible to get them back to that level, but your goal is to get them as independent and active as possible. Now, you can usually get this meeting scheduled within the first 3 days. However, if it's over the weekend, that's going to be hard. And if there's any type of delay in scheduling and your parent has no money to pay for ongoing nursing home care, which can be $200 per day, or if they can't even pay for home care, then it's time to start asking questions about support through the Medicaid program. So it's question time. Time to ask questions like, how does one financially and physically qualify for the Medicaid program? What if my parent needs to stay here in the nursing home and the insurance payments end? What if I can't take care of mom and dad any longer and I need other options? The most important question to ask after you have satisfied and know that a parent meets Medicaid qualifications, both financially and physically, is to ask someone at the nursing home, is there anyone here who can help me apply for Medicaid? So here comes the next hurdle. You have to decide what type of Medicaid you want to apply for. So there's two paths. Medicaid, sometimes called HCBS, Home and Community-Based Services, or LTSS, Long-Term Support Services, or by another name, provides caregivers in the home for a set amount of time each week. Then there's Medicaid Long-Term Care, LTC. This type of Medicaid pays for care in some, and I emphasize some, assisted living communities and most nursing homes that have available Medicaid beds. So the decision you have to make when you apply for Medicaid is, where will mom and dad live? Now that can be a tough discussion. If at home, then you want to apply for the home-based program. If not at home, you want to apply for long-term care. Either way, that person, the billing person, somebody at the nursing home, can help you start the process if you convince them that you are serious. The benefit is that the application process moves much more quickly than if you do this on your own. Now in Colorado, there is a screening form called a ULTC 100.2. I'll place a copy in the show transcript. So if you want to find it, go to my website, PamelaDWilson.com, click on the Media tab in the top bar, then the Caring Generation podcast, and search for episode 153. If you look at the form, you will see two sections. One is for potential community-based long-term care program. That would be the in-home care option. Then residential alternatives like alternative care facilities for developmentally disabled residents, nursing facilities, or an intermediate care or intellectual disability care facility. I know these are all big words, big terms, but what you're looking for is nursing home care, and the payer is Medicaid. So once the person at the nursing home submits the ULTC 100 in Colorado, your state again may have a different name for this form, the timeline begins, the clock starts ticking. So first of all, you want to make sure that you request a copy of that form for your records. Applications get lost all the time. It is a must to be extremely present and attentive to this application process. You have a limited amount of time now to provide the financial background. Make sure the billing person at the nursing home or somebody in the Medicaid office tells you exactly what you must gather and submit. Any delays on your part or providing incomplete or inaccurate information will slow down the process. And depending on where you live, it can take weeks or months for an application to be approved. So time is of the essence. This process to apply for Medicaid that I am describing is an answer to what if a parent can't pay for nursing home care? Medicaid becomes the payer. Now, you might be wondering, well, what if my parent doesn't go to the hospital or a nursing home? What do I do? That's a great question. The process is similar, although you have a little more work to do. First, contact your county social services office. Ask them who administers the Medicaid program. Next, contact that agency. Ask how to apply for Medicaid. Request an application. Again, you have to know whether you're applying for in-home care or nursing home care. Third, gather all the financial information you need and complete the application. Fourth, on the medical side, this is where you've got a little bit more work to do. You will want to request your doctor's most recent medical visit notes for your parent and something called an H&P, Harry and Paul. An H&P means history and physical. Has your parent's diagnosis, their medications. If you can get a letter from your doctor about your parent needing long-term care services, this would be good. But sometimes due to the doctor's schedule, it's just not possible or not timely. The reason you have to go through this extra effort is that when a parent is in the hospital or a nursing home, they have all the medical information in their records, so they don't have to gather it. But if your parents are at home, you have to be the gatherer. Be extremely detailed in all of this. Be present, because any information that you leave out or anything that is completed incorrectly will delay the application approval timing. Once you've submitted the application, continually call to check in every 2 weeks. Document every single phone call, the time you called, the date, the name of the person that you called. Make a copy of the entire application for your records before you submit it, because applications get lost all the time. They will tell you that you never applied. The best possible scenario here to respond to what if a parent can't pay for nursing home care is that the family and the caregiver have early discussions, that you investigate what happens if your parents run out of money, how to apply for Medicaid, that you plan to apply for Medicaid. Rather than the opposite scenario, which is usually what happens, a parent's health declines, you become a caregiver, you think they're going to be able to stay at home forever, something happens, they can't, they go to the hospital, you're burned out, you're exhausted, and you realize that they can't come home or you can't do it anymore. Best advice is don't wait, be proactive. I want to thank you for continuing to post questions for this podcast and all of the videos I share on my YouTube channel. This is Pamela D Wilson, family caregiving expert on the Caring Generation. Again, if you're looking for answers to caregiving and aging questions, visit my website, PamelaDWilson.com, where there is plenty of information. I look forward to being with you all again soon. God bless you all, sending love and light and happiness and good health to everybody. Sleep well tonight. Have a fabulous day tomorrow and enjoy each day until we are here together again.
Tune in each week for The Caring Generation with host Pamela D. Wilson. Come join the conversation and see how Pamela can provide solutions and peace of mind for everyone. Here on Pamela D. Wilson's The Caring Generation.